How do you treat it?
There are really two things that need to happen. There's the medical piece, which is verifying that there's a strep infection, so heading back to the pediatrician. But the piece that I do is really dealing with the fear and lack of understanding of what's going on. Parents have to know what's going on with their child. That's just the only way you can parent, is understanding.
Back, I told Michelle I'd been speaking with Dr. Gray and turned and looked at Michelle, and her eyes were pooling over just at the discussion. I think the whole family is kind of shaken up, and I think Maury is still shaken up, but she's too little for therapy, isn't she?
Not at all. Not at all. It's sort of hard to talk to a 5-year-old, 6-year-old, 7-year-old about the brain. We can give it a funny name and say, you know, it's the brain bug or the worry bug. Part of your brain when you got sick, or if this just sort of started more gradually, started to get strict with you. You have a wonderful brain, but this part's kind of doing, you know, sending you the right message at the wrong time. Is it a good thing to have clean hands? Absolutely. Do you need to think about it 100 times a day? Not at all. So it's like a broken record is going in your mind. Understanding that and calling it a brain bug, what you begin to do is to say, you know what, let's boss back that brain bug. It's kind of like a bully. It's telling you what to do.
You can desensitize that voice, you mean, or you can shrink it down? And
exactly. Think about it. If you think about that voice as Anthony Hopkins telling you what to do, you're going to take it seriously, or the principal or the president or something. But if you think of it as Adam Sandler or SpongeBob or something like that, it changes everything. I mean, the analogy that I like to think of for OCD is junk mail, because we all get mail through our mail slot. Some of it's important bills and personal mail, and some of it's junk mail. It all comes through the same way, but we know how to recognize what's important and what's not. And that's what needs to happen with OCD. It's different from our other thoughts. These thoughts really don't belong there. So like with junk mail, the sooner you recognize what it is, you're not going to waste your time highlighting your junk mail. You rip it up and you throw it away. And that's really the mindset that needs to be created for folks dealing with OCD.
When obsessive-compulsive behavior surfaces so suddenly, many experts now look for a strep infection. That's right, the same bacteria that causes strep throat may trigger OCD in genetically susceptible kids.
Where the antibodies that the body produces to fight the strep attacks healthy tissues instead in the brain, in the area of the brain that filters out thoughts.
Tamar Chansky of the Children's Center for OCD and Anxiety says antibiotics and antidepressants can produce an immediate improvement. Still, therapy is often needed to control what she calls sticky thoughts.
Because they get stuck. You know, other kids might think about them and then they quickly sort of go through the net and they forget about them. But for these kids with OCD, they're stuck and they keep thinking about them over and over.
Imagine if you were driving and you had a near miss with someone. That feeling is, your heart starts racing, you start feeling so frightened, and that's just the chemical and mechanical misfirings that happen in OCD.
With the help of Dr. Tamar Chansky, author of Freeing Your Child from Obsessive-Compulsive Disorder, is able to treat the chemical imbalance of OCD.
It's very empowering for kids who have felt like this is coming from them, it's their fault, to start to say, no, that's OCD, that's brain bug, and I'm not listening.